we will call our meeting in Family, Seniors, and Health to order. Secretary, please call the roll.
Senator Carter.
Here.
Senator Lewis. Senator Hudson. Here. Senator Nicola. Here. Senator Nernburn. Here. Senator Bratton.
All right, with quorum established, I move that we go into executive session. Do I have a second? Thank you. I have a motion and a second. All in favor say aye.
Aye.
Any opposed say no. The ayes have it. I move that we bring up, we are in executive session. I move that we bring up Senate Bill 90. Can I get a second?
Second.
Thank you. I have a motion and a second. Yeah, Senate Bill 90, right. So this is Senator Weber's bill. There is a substitute. Is there any discussion on the substitute?
I'd like to discuss the whole thing, but is that all right?
Okay, yeah. Senator?
Yeah, thank you, Madam Chair. This bill is it's a tough one for me, and I understand the need for it. I know there are veterans that are asking for this. I am concerned now that we are handed a sub, and this is now going to open it up to sex trafficking victims as well for the use of psilocybin, and I refer to it as magic mushrooms. And one of the reasons I personally have a little issue with this bill is in the past I've abused magic mushrooms, and I know the effect, the powerful hallucinogen that this really is. How it affects the mind, all of the serious side effects that comes with it and with the abuse. When this bill came up the first time we discussed it, I mentioned one of my main concerns is just like marijuana, it entered into the medical realm to help people with all kinds of different symptoms and diseases, and I've known people personally using it. I tend to lean a little more libertarian in that. I have a problem sometimes with government regulating some of these things. And I certainly understand people needing relief from all kinds of things, and PTSD and using psilocybin. But I also have a concern, just like marijuana, that this is going to end up in a few years right alongside marijuana on the corners being sold. And so with adding the sex trafficking victims, I think that's just another little sign that this is going to continue to be used in all kinds of different areas. And it's a hard one for me to vote on, but I am going to be a no today on this, and I wanted people to understand why. So thank you, Madam Chair.
Thank you. All right, any other discussion on this legislation? Go ahead, Senator Lewis.
I appreciate the senator's comments, and I recall when we heard this hearing, I specifically asked the bill sponsor, why is this only focused on veterans? I think we have to be, creative and think outside the box with post-traumatic stress disorder, and I do appreciate him, expanding a little bit. I mean, quite frankly, I would like it open to everybody, because suicide, post-traumatic stress, it's definitely has some regulations. It's not, it's in a clinical setting. But I just, I do understand the senator's concerns, but wanted to just share, my perspective kind of on the other side.
Thank you. Any further discussion? Thank you. I do want to say that this is kind of a hard issue for some of us, right? I don't think that I would be a yes unless I had family who have been in the military for 30 plus years. And I don't want to see them having, it's to gather scientific research on what we know is happening in other countries where they're getting a treatment once, and it's actually helping them be able to overcome other addictions and drug abuse, alcohol abuse. And so while it is a conflict, I think it's something that we're going to have to watch to make sure that it isn't abused. But again, it's tragic for me to sit and see family members trying to save pennies to go to another country to get what they think is a solution, and not be able to have access to potentially that treatment here. And so we'll just walk this as judiciously as we can. Thank you. Thank you for the discussion. All right. Any other discussion? All right. I move that we do pass Senate Bill 90. Yep. I want to adopt the sub. Can I get a second?
Second.
Thanks. All right. Now I move that we do pass Senate Bill 90. Do I have a second? Okay. Thank you for the second. Can I get a voice adoption on all those in favor of adopting Senate Substitute 90? Can I get all in favor say aye? Aye. Any opposed? All right, thank you. So can we get a roll call vote on the Senate sub on Senate Bill 90? Secretary, please call the roll.
Senator Nernbern,
Aye.
Senator Lewis,
Aye.
Senator Hudson,
Aye.
Senator Nicola,
No.
Senator Carter,
Aye.
Senator Bratton.
Okay, with your vote of 4-1, we have adopted and passed Senate Bill 90. We're going to go into now Senate Bill 100. This is the Senate bill on the marriage birth certificates. Thank you. Are you guys good on this one? 'Cause we don't have it. Okay, all right. All right. So I move that we go to Senate Bill 100. Do I have a second?
Second.
Thank you. Any discussion on this bill? Seeing none, Secretary, call the roll. Okay, can I not do that one? I brought the bill up. I need to do pass it. Can I get a second?
Second.
Thank you. All right. Any discussion? Secretary, call the roll.
Senator Nernbern, Senator Lewis, Senator Hudson, Senator Nicola,
Aye.
Senator Carter,
Aye.
Senator Bratton.
All right, with your vote of 3-2, we have do pass Senate Bill 100. I make a motion that we now go to out of executive session. Can I get a second? Thank you. All right, we are out of this executive session. We are now going to hear Senate Bill 336 by Senator Moon. Begin when you're ready.
Good morning. Thank you, committee, for allowing me to present Senate Bill 336 this morning. My name is Mike Moon, and I represent the Missouri 29th Senatorial District. I have a question for the committee. Have you ever been to a restaurant and you open up the menu and you see no prices listed? If you've had that experience, you probably have realized that the prices are pretty high, right? Well, imagine another scenario. You walk into a store, any store you wish, and you go to a place in the store that has an item that you need, and you pick the item off the shelf, but there is no price. And you walk up to what should be the checkout counter, and they just motion you on out the door, and they want you to use the product. And then a couple of weeks later, you get a bill. And the bill surprises you because it was probably more than you would have spent had you known what the price was when you picked it up off the shelf. Well, let's transfer that over to healthcare. Oftentimes, we don't know what the prices are for the procedures that we need, and that shouldn't be the case. In fact, it was January 1 of 2021, there was a hospital price transparency rule that was issued by the feds, and what it required was that the prices be publicly posted for things like discounted cash prices, and also it required hospitals to provide patients with an out-of-pocket cost estimator tool. And I looked at one of our local hospitals, not in my district, but close enough, and they do have a price calculator tool. I tried to use it, and I wasn't successful. Now, someone else a little more savvy than me probably could have gotten it to work. And I'm not saying that it doesn't work. I just couldn't get it to work for myself. And so what I'm looking at with this particular bill is something that the people have actually asked for, some price transparency. And what it would amount to is like there is a, this one has listed for Walmart, and I don't have all their prices, but one shows an injection that the identified minimum negotiated price is $899.33. The identified maximum negotiated price is $9,260.13. Now get this, a cash discounted price, if you have cash to pay, it's $21,362.63. So you be the judge. Which would you choose? I know which one I would probably choose. And I think that consumers, and we're talking about patients now, who sometimes actually need these services, they don't have any question about whether they can take advantage of it or say, you know what, I'm going to sit this one out because it's too high. They just want to know what the price is going to be. A little transparency here. As I looked over the hospitals in Missouri, the vast majority are non-compliant with this particular rule. So what would 336 do? First, it would require that we comply with the federal rule. And then if there is a case where a patient is being sent to collection, unless a hospital is compliant with the federal rule with transparency and pricing, they cannot collect that debt. So it's pretty simple. It protects the consumer. And as I mentioned, the people want it. They want price transparency. Now let's see who stands for the people. I know that there are going to be some opposition here, and I expect that. But I think that it's clear that we've come to a point in our age where technologically, and I just admitted I'm not as adept as I should be on that one price tool that I couldn't get to work. I'll get that figured out. But we should be able to look at what the cost of the procedures will be, and we can pick and choose which one we would want to take advantage of. So if you have questions, I'd be happy to attempt to answer those. And thank you for letting me present this bill.
Thank you, Senator Moon. I do have one question in particular. You referenced law currently that's in place that is not being abided by. What is the mechanism in your bill that would give teeth to this? I mean, if there's already statute.
If the hospital is not compliant, then if they want to attempt to collect a debt owed by the patient, then the law would say you can't collect the debt unless you're compliant with the federal rule.
Yeah. Okay, thank you. Any questions for the senator?
Senator, thank you so much for bringing this up. I am always for as much transparency as we can possibly get, and people would know exactly what prices are. So thank you for bringing this piece of legislation to our attention.
You're welcome.
Any other questions for the senator? Seeing none, we will begin with those in favor.
What a glorious day, Madam Chair.
It is.
Be
Can we
before
get a
your
picture?
committee and, as Senator Moon said, be for the people today.
Did you say beef?
Be for the people.
I thought you said
Eat
beef. Beef for the people. Yeah.
Shannon Cooper today representing America's health insurance plans. We just want to go on record in support of this legislation and maybe a little historical knowledge. During his first term, President Trump, in an attempt to allow consumers to better manage healthcare costs, put this regulation in place. And I think maybe it's the top 300 most common services that the hospitals have to provide numbers for. And as Senator Moon pointed out, very few people follow, very few organizations follow that rule. This legislation simply says, hey, you need to follow the rule, and if you don't, you can't charge the consumer because you didn't uphold your end of the federal rules. So we're happy to support it. We think transparency is good for all consumers so that they can make wise decisions when they go in and have procedures that maybe are not necessary but needed. It doesn't deal with life-threatening issues. It just gives them an opportunity to look and budget and figure out, hey, how much is it going to cost to get this procedure done? With that, I'd be happy to answer any questions.
Any questions for the witness? Seeing none, thank you.
Thank
for
you, Madam
testifying.
Chair.
Appreciate it.
Thanks, sir.
Next in favor? How many are here to testify in favor? how many here are here to testify against? All right, thank you.
Good morning, Madam Chairwoman. Hampton Williams with the Missouri Insurance Coalition. We speak in support of this bill. Just very briefly, one of the mechanisms of this bill would allow an individual who's received a debt that they would wish to contest the ability to get an injunction against the enforcement of that debt. That would, if somebody gets a large bill dropped in their lap, it would allow them to go to a court, file for an injunction to prevent that debt from being levied against them, and sometimes that could lead to displacement, or people ended up unhoused because they have these substantial medical debts. So we support this bill again for the purposes of price transparency, as Mr. Cooper had previously testified.
Thank you.
Thank you.
Any questions for this witness? Seeing none, appreciate your testimony. Next in favor? Don't be shy. Going, gone. All right, first in opposition.
Madam Chair, members of the committee, Rob Monsess on behalf of the Missouri Hospital Association, here to testify in opposition. I appreciate Senator Moon bringing this forward. And just the hospitals in the state are doing their best to comply with an ever-changing landscape on transparency. This chart here shows all of the various federal transparency changes that they're having to comply with, changes that have, I think the law passed in back in 2021 or 2022. These changes have been stepped forward consistently every year. I think a year ago, January, there were new changes related to machine-readable format. 6 months after that, additional changes. The previous witness mentioned President Trump's executive order during his first term. They just issued an executive order a little over 2 weeks ago that have promised vigorous enforcement of the federal rules. So I understand the desire for transparency. I think hospitals are doing their best to comply. The most recent information from the American Hospital Association showed that compliance was moving upward, and as many as 70% of hospitals, by their metric, were complying. There are a bunch of different metrics that are out there. So some groups that have been advocating for these policies in other states would have that percentage much lower. So we would be concerned about just kind of what is deemed to be materially compliant. Interested to learn or to see that our friends in the insurance industry that are here. President Trump also issued rules related to transparency for insurers. So if there's going to be state policy on transparency for insurance, perhaps this bill could be amended to include transparency on the insurance side. Lots of times there's differences between the cash price of what your constituents will pay, and then, of course, the price for those that have health insurance. And those values are negotiated between the provider and those insurance companies, and everybody's plan is different. And so the amount that is being paid out of pocket by your constituents can vary based on what those plans are. So we are certainly not opposed to transparency. Our hospitals are doing their best to comply with the myriad of federal rules. I do think that President Trump has promised vigorous enforcement of the federal rule. I would also let you know that according to the Government Accountability Office, CMS, the Centers for Medicare and Medicaid, which oversees these rules, they've initiated 1,287 enforcement actions between 2021 and 2023. 851 of those were initiated in 2023, with over $4 million in civil monetary penalties. So I would just ask, is this additional layer of protection, is it necessary? Our contention would be that it's probably not necessary. If there is a desire on the part of the committee and the state to pursue this, we think it would make sense to pursue it in a broader sense, to have not just hospitals singled out, but to have, insurers and others. Obviously, they're very pro transparency because they're here testifying on this bill today. So we would welcome changes that would modify that. So with that, I'm happy to answer any questions.
Would you be willing to share that data that you have there with the rest of the committee, and we'll distribute that?
You bet.
Appreciate that. Any questions for the witness? Seeing none, thank you for your
Thank you.
testimony. Next in opposition.
Thank you, Madam Chair, members of the committee. Justin Alferman, registered lobbyist for SSM Health. So I want to point out to the committee that there's two ways or two requirements under CMS guidelines for falling into compliance with the federal statute. The first is display a shoppable service in a consumer-friendly format, which is pretty easy to do. The second one is a comprehensive machine-readable file with all items and services. There are times whenever you do the machine-readable printout that whenever it gets logged into CMS, a comma is missing or a decimal place is missing, and that throws the entire file out of compliance. I don't say this happens often, but it does happen on a, I would say it happens infrequently, but that machine data being able to be readable sometimes will throw you out of compliance. Now, to the best of my knowledge, my 34 hospitals operating in 4 different states, we are all under compliance right now. And I love this this bill because it gives me the opportunity to talk about our price transparency website. You go on Google and you type in SSM price transparency. I can tell you in each one of the 9 hospitals in the state of Missouri, based upon that hospital, we can type in your insurance, we can type in non-insurance. I can give you a price within 5 minutes, probably even less than that. And in fact, I did it last year in testimony. I did it in real time. We're not against price transparency, but like Mr. Mons has said, we already have this at the federal level. We deal with this compliance almost on a daily basis.
Thank you. Thank you for your testimony. Any questions for the witness? Seeing none, thank you.
Thank you.
Make sure you leave a witness for him.
Good morning, Madam Chair, members of the committee. My name is Alex Tuttle, here on behalf of Hannibal Regional Medical Center and Golden Valley Hospital out of Clinton, Missouri. I want to thank the Senator for bringing this forward. We fully support price transparency. Again, mentioned before, we are following the federal rule. I want to bring up a couple points that was not raised already. We're 2 rural hospitals in rural Missouri. As you know, there's probably several miles between our hospitals and others. Community benefits was not mentioned in the testimony. Hospitals provide more services than just patient care. They provide community benefits that cannot be measured. Talking about like diabetes skills testing, hospital ambulance services, they operate these without a tax. So they operate on a loss. So they provide these services in the community as well as other benefits. So happy to answer any questions.
Thank you. Any questions for the witness? Seeing none, appreciate your testimony.
Thank you.
Next in opposition.
Madam Chairwoman, members of the committee, I'm Kathy Harness, and I'm here today on behalf of St. Luke's Health System. We have hospitals mainly on the western side of the state, both in Missouri and Kansas. And we do have a portal that you can go to, get an estimator of the cost of our services, and all of the hospitals in our system are compliant with the federal law.
Thank you. Any questions for the witness?
No.
Seeing none?
Yes.
I appreciate that. Next in opposition.
Good morning, Madam Chairwoman, members of the committee. Olivia Wilson here on behalf of University of Missouri Healthcare. We just wanted to do a Me Too in opposition to the bill. It's important that we're able to collect debt on our services. It's oftentimes what keeps us in business. We make great efforts to remain in compliance with federal hospital pricing transparency laws, and we offer a lot of options available online or via the phone for folks to get a better, accurate depiction of what their bill will be. I'm happy to take any questions.
Thanks. Any questions for the witness? Seeing none, appreciate your testimony. Next in opposition? Seeing none. Any for informational purposes only? Seeing none, Senator, you're free to wrap up.
Thank you for allowing me to present the bill, and I think we made progress over last year. And again, I think that if it helps the people make better decisions about their health care, I think we ought to do it. So thank you again.
All right, thank you. All right, next we will hear Senate Bill 519, which, will you take over?
Where's the manual? Okay, Senate Bill 519. Senator, whenever you're ready.
Thank you. Thank you, Mr. Chair, committee members. Basically, this bill does, in the event of a pharmacist is unable to obtain a refill authorization from a prescriber, it includes including due to death or incapacity, the pharmacist may use their professional judgment to fill a prescription as needed for an emergency period, as long as the amount dispensed does not exceed 90 days. We know that most healthcare providers have procedures in place to help mitigate a patient from missing their necessary doses, but this bill attempts to provide another tool for patients to ensure and they are receiving the care they need. Our focus is putting the patient's needs first. Currently in statute, pharmacists are already allowed to fill prescriptions in emergency situations. My bill only extends that amount that pharmacists are able to provide from 30 days to 90 days. This bill does not pertain to controlled substances. The focus of this bill is for everyday medications such as insulin, blood pressure medications, and other vital prescriptions Missourians depend on. Some of the situations that I'm hearing about, and I'm seeing even from a dear friend, is some doctors going out of practice. That leaves them without the extension of being able to get these prescriptions. Even when they are looking to go to another doctor to establish a relationship there, sometimes it's taking them months to get into that other doctor. And so that's leaving them a gap where they're not able to get at times their prescriptions filled. So we're just extending this. That's all this bill does, extends that time to 90 days. So thank you. Happy to take any questions.
Thank you, Senator. Any questions for the Senator? Seeing none, thank you. Any testimony for Senate Bill 519? Thank you for your witness form.
Chair, members of the committee, Henry Talmock with the Missouri Pharmacy Association, as well as RX Outreach, to go on record as in support to Senator Carter's bill. I think the senator put it well by extending the windows. I think it's 7 days to 90 days and 30 days to 90 days, but it's up to. It's not required or mandated that a pharmacist dispense 90-day medications. It's in the prerogative of the pharmacist, who probably is the best provider, who understands the pharmacogenomics and pharmacology better than any of us, right? They went to school for that. They understand the contraindications of a medication that a patient is taking and how much to dispense at that moment in time, if, in fact, a physician or a provider does leave that region or the hospital system or the practice itself. So by extending those, the days, and allowing the pharmacist to continue to treat the patient, you keep them adhered to their medication and the regime that is in place with that provider, while allowing them to establish a patient-physician relationship with their next provider if they can find one.
Well, thank you very much. Any questions for the witness?
Thanks.
Well, thank you, sir. Appreciate it. Any others in support of SB 519?
Good morning, Mr. Chairman, members of the committee. My name is Jackie Barget. I'm a registered lobbyist here on behalf of Walgreens. I will just say ditto to what the previous witness would say, and thanks, Senator Carter. I have tried to get 2 new doctors to establish new patients, and it has taken 6 months to get in to see them. So it is very much needed.
Well, thank you very much. Any questions for the witness? Seeing none, thank you. Any others here in support of Senate Bill 519? Okay, seeing none. Any in opposition?
Mr. Vice Chair, members of the committee, Jacob Scott with the Missouri State Medical Association. Sorry to be the skunk at the picnic, but we do have a little bit of opposition. I've talked to the senator and her staff about the bill, and I think it's certainly well-intentioned. There's a lot of desire to, amongst us and all the stakeholders, to increase the amount of physicians and decrease these wait times that we see patients trying to get in to see a physician. And I think the current law is actually a really good law. You know, if you look at the current law, it's, you know, you get 7 days, and it doesn't cap how many times you could do that. So if you run out the next 7 days, you can go back and get more. And then additionally, it says down in subsection 4 on line 36, I believe. No, let's see here. Somewhere in there, there's a notice that's given to the physician's office, or in many cases, this is a health system. You know, if you are receiving your health care at a major hospital network, then, you know, there's other providers that should be able to, you know, continue the care when you message them on the portal. So I think there's definitely some conversation that can be had if the 7-day is not working or the 30-day is not working, but because it's not limited, I think that there's probably a good law that already exists for this. And then the other thing I would just note is the current law, of course, is for in cases where the provider has a death or incapacitation. The way that this legislation is written, it adds a comma on line 4, and then it says including due to death or incapacity of the prescriber, which the way I read that would open up a whole list of opportunities for this medication to be filled. You know, it could be they call the doctor's office and no one answers the phone, and they decide in their professional judgment to do that. But at the end of the day, this is a judgment call that's often made by the pharmacists, and, you know, the law allows for that. So in their professional judgment, I just think there's certainly medications out there, even though the sponsor said that it doesn't pertain to controlled substances. There's still other medications out there that you really shouldn't be having for 90 days without looking at your vitals and looking at the different factors that might go into whether or not you continue that care or that medication. So with that, I'll stand up for any questions.
Well, thank you very much. Any questions for the witness? Seeing none. Thank you for not smelling up the room too bad as well. Appreciate that. Any other testimony in opposition to Senate Bill 519? Seeing none. Senator, any closing comments you would like to make?
No, I just want to know, I mean, I know words matter, but these are just a couple of 90 days, changing this supply from 7 days to the window from 7 days to 30 days to now being 90 days. And they do have to notify the doctor or someone that they are receiving the prescription within a window of time. So they're not just, the pharmacists aren't able to just prescribe that without notifying the doctor. So thank you very much for letting me hear this.
Absolutely. I did forget if there's anybody here for informational purposes only. All right. Well, thank you very much. This concludes our Committee on Families, Seniors, and Health. I'd like to adjourn. Do I get a second? Thank you very much. We are adjourned.